Heartworm disease is a serious and potentially life-threatening condition transmitted by mosquitoes. It has been diagnosed around the globe, including in all 50 states in the U.S. Despite having safe and effective medications, the disease continues to spread. Dogs and cats that are not receiving a preventative in endemic areas are particularly at risk for infection. Additionally, even when monthly heartworm preventatives are prescribed, there is a risk that those medications are not administered as directed. With one bite, an infected mosquito can transmit microscopic heartworm larvae, Dirophilaria immitis, to any dog. From the site where they are deposited by the mosquito, heartworm larvae enter through the bite wound and begin their migration through their new host. Over a course of several months, they migrate to the pulmonary arteries and the heart, develop into adult heartworms, eventually producing microfilaria to complete the life cycle. Killing the heartworms before they develop into adults is key. Heartworm preventatives are effective against the L3 and L4 tissue stages of heartworms. Therefore, it is important that dogs receive preventative throughout the entire heartworm season. ProHeart 6 provides a unique option for heartworm disease prevention. It is a sustained-release product that is administered by the veterinarian and provides 6 months of heartworm protection in a single injection. In addition, ProHeart 6 treats existing larval and adult hookworm infections caused by Ancylostoma caninum and Uncinnaria stenocephala. ProHeart 6 is a professionally administered subcutaneous injection that eliminates uncertainty of pet owner compliance with heartworm prevention for 6 full months. ProHeart 6 is unique among heartworm preventatives in that it uses microspheres to prolong the effects of the active ingredient, moxidectin. Microspheres are very small, solid spheres made of an absorbable lipid, glyceryl tristerate. ProHeart 6 microspheres have moxidectin dispersed throughout them. When ProHeart 6 is injected, the microspheres begin to slowly dissolve, releasing moxidectin, which redistributes to adipose tissue and acts as a reservoir, allowing 6 months of prevention for canine heartworm disease. Moxidectin, the active ingredient in ProHeart 6, is a macrocyclic lactone that is neurotoxic to susceptible parasites. Moxidectin binds to receptor sites on the nerve and muscle cells of the target parasites, opening glutamate-gated chloride channels, causing a prolonged influx of chloride ions into the cell. This disables the cells of the parasite's neuromuscular system, causing paralysis and death. These receptors are less accessible and less sensitive in dogs, contributing to a wide therapeutic safety margin for ProHeart 6. The unique ProHeart 6 formulation of microspheres with moxidectin delivers 6 months of assured heartworm disease prevention. Now let's take a moment to discuss important safety information that you'll need to consider before administering ProHeart 6. ProHeart 6 should not be used in sick, debilitated, or underweight dogs, or those with a history of weight loss. Use with caution in dogs with pre-existing allergic disease. Some dogs show mild transient swelling or itching at the injection site. Owners should be given the client information sheet for ProHeart 6 before the drug is administered, and observe their dog for potential drug toxicity and allergic reactions described in the sheet. Animals showing signs of drug toxicity or allergic reactions should receive immediate veterinary assistance. In people, ProHeart 6 may be slightly irritating to the eyes. ProHeart 6 is available only through a restricted distribution program. Veterinarians enrolled in this program can receive and administer ProHeart 6. ProHeart 6 provides 6 months of heartworm disease prevention through a veterinary-administered injection, eliminating the burden of heartworm compliance for the pet owner.